This episode of the Operatory podcast is brought to you by Opera VR Digital Nitrous, the immersive patient anxiety melting experience proven to be as effective as nitrous oxide with no drugs. True drug-free sedation with Opera VR. Go to digitalnitrous.com. Welcome to the Operatory podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures, and finding a better way. With me today, providing the patient experience, the patient's perspective, as always, is my friend, my man, David Pryor. How are you today, sir?
Good, Brian. How are you doing?
I'm doing great, man. I'm doing really well. Although, I'm kind of annoyed.
Well, what did I do now?
This one wasn't you, sir.
How is that possible?
I don't know. I don't know.
It was the source of all pain in your life.
There are other things in this world that can annoy me besides you.
Oh, I have a PhD in the... So.
You're just the master of it.
I am.
Thank you, sir. I appreciate that. No. You bring all sorts of joy to my life, so thank you.
You're welcome.
But what doesn't bring me joy, and it brings lots of angst to many of our listeners, I'm sure, that I wanted to sort of unpack this issue sort of on a deeper level today, is contracts.
Sure.
Contracts. Getting wrapped into something that you don't want to, don't need to, automatic renews, and it just is pervasive in our industry, and I just can't. It just goes against every fiber of my being. And you've been there sometimes when I've had to have sort of, the come to Brian meetings with companies who use unscrupulous tactics to get you wrapped into a contract that's auto-renewing, and then you cancel it. They act like they didn't get your cancellation, and then they just keep it going.
Sure.
Does that make sense?
Yeah.
I'm sure you've had experiences with this too, sir.
Well, sales guy, I've had tons of contract experience.
So on both sides or just on the...
Both sides.
Both sides,
Yep.
Yeah. So have you been the receiver of the vitriol from the person who's been wrapped into a contract?
Yeah, I was in telecommunication sales for a decade. So there's a contract you don't want to go against.
Oh, man. Telecommunications
Telecom.
is just like... That is like that's like the birthplace of contracts, right?
Yeah.
In the United States, people who our listeners may not know that in other countries, you don't get wrapped into a 2-year contract with your cell phone carrier when you buy a phone. You just buy a phone and then you have the service. And if you want to switch services, you can. Mm-hmm. Not here. You can't buy a phone outright. You probably can, but you have to burn some calories to do it.
Yep.
But that's so. So tell me about your experience on the other end of as the purveyor of this pox.
Well,
Dave, that's your new nickname, purveyor of poxes.
From at least in telecom, it was specific. It was you're getting roped into this contract because you want some extra special deal, and so it's like in order to get the extra special deal, you have to commit to service for this amount of time. So
Was there an option to not do that?
Yeah.
Okay.
Yeah.
Well, that's different.
Yeah, and so I mean, but what I see in other industries where it's just a way for people to be able to be lazy as a salesperson. I don't need a relationship with my customer. Once I get them on contract, my job is done. And so as a salesperson for Opera DDS, we don't do contracts, right?
Yeah.
So it goes with how I like to perform as a salesperson, which is do a good job and you won't have to worry about a contract.
Yeah. And there's another level of the contract, which is almost the flip side. Which is because we've talked about contracts before on this podcast. The flip side that I wanted to talk about was how attorneys and accountants bill per hour. That's like almost the opposite, where it's like every time you make me think, I'm charging you.
Yes.
Right?
Yeah.
And that just it's equally frustrating.
Yeah.
Yeah, especially, most of there are flat fee accountants, there are flat fee, retainer attorneys, but man, it's like both the annual contract and the sort of bill per second is both sort of non-transparent and gets you locked into whatever that person's going to be doing, right?
Yep.
Versus in dentistry, I think probably the reason why I have such an aversion to both those styles of billing is because in dentistry it's very different. We bill like per surface. We don't even charge like for a filling. It's like, oh, did you do one surface? Did you do two surface? Did you do three? I mean, everything is like you only get paid for an outcome, right?
Right.
And then on the back end, we have to guarantee that we don't have to, but you pretty much have to guarantee that there's a positive outcome. And then if the patient's unhappy, we have to deal with that. Versus if you're in a contract situation, if you bill per minute, it's like, oh, your contract sucked that the attorney did. Guess what? You pay them to redo it. Oh, they missed something. You've told them to do something. You pay them to fix it. It's completely opposite from how our world works.
Right.
And I'm not saying our world is right, but it sets us up for vitriol against the other worlds. Does that make sense?
Yeah, for sure. Because, I mean, I don't know how you think that you're not guaranteeing your service, because from somebody that has to be in that situation,
Yep.
you absolutely guarantee your service. I mean, if a patient isn't happy with the outcome, with the result of the procedure, you keep working on it until it's fixed.
Well,
right?
and you're talking about what we do is unpredictable.
Right.
Right? What an attorney does is pretty much predictable.
Right.
Like, don't screw up the contract, you know?
Yeah.
And you know, I recently had an issue with an attorney where I was working, you know, it's a contract between two people.
Sure.
So this attorney on the other side, my attorney wrote up the original document. The other attorney basically did it and does what I think lots of attorneys do, which is basically took their contract and overlaid it over mine and just read everything. And I was like, well, I'm not going to be paying my attorney to go through a bunch of revisions that have no substantive value, just like appeasing your attorney. So then I said to the other person, well, why don't we just have a discussion, come to the agreement, and then we have both the attorneys kind of look at it and verify versus that. And they said, yeah, that sounds good. So I went to their attorney and said that that's what we're going to do instead of using their BS contract, and was told, you can't do that. Dave knows what my response was to that, I guess.
I do.
Yeah. And it's just, I mean, I just feel like we as dentists, as professionals, as people who are out there in the world buying products, just be on the lookout for both of these things. Right?
Yeah.
And it's more difficult in the pay per hour for attorneys and accountants because that's how their world works.
Yeah.
And so but they're having worked with attorneys and accountants who acknowledge that and bill appropriately versus those that don't. I can tell you, if you're stuck in one of those situations where you feel like all attorneys, all accountants do that, that's not the way it is.
Well, so let me get you on a little tangent on that. Do you have some best practices for working with attorneys in dentistry? Because I think everybody runs into that, right? Where they get anxious about the billable hours that an attorney can put on there. And my experience when working with contracts and attorneys is there will never be a contract that I submit to an attorney that they won't redline something. They have to redline something to justify their work, right? So they're going to, by nature, have to do something.
Yeah. Yeah. But here's what I would say is I don't really have a criteria, but what I do is every attorney, every accountant, everybody I'm working with have the conversation on the front end. And their response will, what's the saying? People will show you how to treat them, or they'll tell you how they feel about this issue. And this is not a footnote. This is a big part of the conversation because the thing is whenever engaging with, let's say you're going to work, let's say you're a dentist, and the normal dentist doesn't do tons of contracts, right? So they might a few times in their career or a bunch, maybe they have an attorney a few times a year to look at something. So they don't think of it as a big deal when they're engaging with that first contract with an attorney. Mm-hmm. But what's going to happen is it's going to be a problem at some point if you don't talk about it on the front end. It's being able to set the expectation that this is how you bill, right? Which is they always disclose that. But then you can say, here's my concerns with how you do things. And that way it's almost like it's always better to have a reason versus an excuse, right? And if you set expectation on the front end, this is the way my billing works. This as a dentist.
Yeah.
This is the way your billing works as an attorney, as an accountant. I understand how there's differences here. However, I don't like the way your billing system works because of how I bill.
Right.
So on the front end, know that's my perspective. And so I want to hear how you feel about that. And then their response will tell you volumes.
Yeah.
Does that make sense?
Yeah. Oh, for sure.
And on the other side, you have an annual contract that I can't cancel.
Right.
Can't cancel.
Right.
Right. And it auto renews. And if I'm a day late or whatever, I don't honor that. Well, guess what? I'm doing business somewhere else.
So I've had positions that I've been in where that Evergreen contract language was in there. You can always get that removed. I've never been in a situation where you can't get that removed because I understand what it's there for, but it should be for your benefit to have that language in there. And if you don't see the benefit of it, then yank it.
Well, so if there's an option to do, whatever, month to month or something else, and then there's an annual option where you get a discount, right? And then you pay up front and you don't get money back, and so you've already basically prepaid the year.
Yeah.
That's totally different than being wrapped in and you can't cancel.
Right.
And so I'm thinking about specifically for like the infection control companies that come in every week. They'll wrap you into like a 2-year contract that auto renews, and I've specifically canceled them, and then they pretend like it didn't get canceled.
Yeah.
And that's one example of many where it's just there's going to be different. Everybody would want you to be into their system for longer, so they'll give you an incentive to do that. That's different than like the only way to buy this phone is to only use our service for 2 years. Right. That's the way most people buy their phones. And then if you have crappy service, guess what? My cell phone doesn't work in my house. Oh, for 2 years, right? That's so just again, similar to what I was discussing with accountants and attorneys. Just make sure you know what you're getting into on the front end. That's kind of where my head is at after having this frustrating experience with these attorneys where my attorney respects time, respects the client's finances. The other attorney is the opposite. Let me put it that way. So I was like, I'm so mad. We have to do a podcast about this to warn others because if I had been listening to that podcast, if I had played the podcast for the other party first, say, okay, you want to find an attorney, just make sure that it's not going to be the person that's going to burn. That's the other. Burns my time and money too,
right?
Because now my attorney's got to review this piece of garbage that they went through, right?
Yeah.
And so feel free to pass this podcast along to somebody that you're going to be doing business with that doesn't have a good attorney that is looking out for everybody's best interest.
Well, and it'll save you both a ton of money
and time.
Yeah,
I mean, I like whenever possible going into a contractual arrangement, discussing it, coming up with like the broad strokes of what you guys want to do prior to going to the attorneys all the time. Because no attorneys made things less expensive, simpler, or make the deal seem better to anybody, right?
Yep.
That's the way it works. And my wife's an attorney, so I can talk about them a little bit more than the average person, I think. But and there's great attorneys out there. There's great accountants out there. There's great infection control vendors and software companies that don't wrap you into contracts. So just seek them out, and everybody would change.
Yep.
Thank you, sir.
Thank you, Brian.
I also want to remind you to rate and review us wherever you're listening to this podcast. If you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Brian Laskin, host of The Operatory. Thanks for listening. I look forward to speaking with you next week.